Good afternoon. Thanks for taking the time to be here today. I'm Dan Tsai, the Director of the Department of Public Health, and today we'll be announcing, in partnership with the OCME, the number of overdose deaths that we had in San Francisco this month, as well as some of our additional programs to really combat this. So jumping straight to the data, in the month of May, we had 57 overdose deaths. That is still 57 too many people dying in the city and county of San Francisco from overdoses. Year to date, since January, that is 311 people that have died of overdoses. It is down from this time last year, which was 329. Over the course of this year, we've had between 62 to 71 overdose deaths per month between January, February, and March. April was 55, May is 57. As per recent history, the majority of those overdose deaths have fentanyl as opioids as a major piece of that, but we are also seeing continued involvement with stimulants, methamphetamine in particular, and I will talk about that some more. I want to note, as I do every single time when I come announce these numbers, is that every single one of these deaths is preventable, unacceptable, should be avoided, and we're not going to rest until that happens. As a part of the city and this administration's approach to tackling the opioid and the drug use crisis that we have, this epidemic in the city, we are really focused on making sure we're able to help people get access to and get connected to treatment, and to be able to be on a path to sustained recovery, and to do so much more proactively. I continue to say we will not be satisfied with whether or not I can come here and talk about 50-ish or 60-ish deaths per month. We want to see those numbers go dramatically down. And so one of the very important pieces I want to talk about today, and I'll have some of our clinical team talk about, is a clinical intervention that we in San Francisco are at the forefront of, and it's called contingency management, and it's specifically tackling stimulant use disorder, meaning individuals who are using meth or cocaine. And what's really important to note here is that whilst the majority of our overdoses and deaths are due to fentanyl, we have about a third of those deaths of folks having some co-usage with methamphetamine. And unlike fentanyl and opioids, where there are FDA approved medications to help treat usage and addiction to fentanyl, there is no FDA approved drug to help tackle someone who is using stimulants, particularly methamphetamine and cocaine. However, there is a gold standard evidence-based treatment intervention that we in San Francisco are at the forefront of, which really involves providing a carrot, an incentive, a monetary incentive for individuals to engage in treatment and a range of programming to help reduce and actually eliminate their use of a stimulant, and to actually be able to maintain that level of recovery. It is very exciting. We in the city here operate 12, 13 of those programs. We are in the midst of expanding those. This is something that folks across the country are trying to do more of. I'm very proud that here in San Francisco, we have a range of programs, and we at DPH here are actively expanding those. I will turn in a moment to Dr. Christy Soran, who will talk through some more of those details. We were also going to have a client, an individual who has successfully graduated from one of these programs. He unfortunately was not able to be here this morning, but I want to emphasize these are the types of things that we need to more creatively utilize here in San Francisco to be able to tackle proactively and with an active focus on treatment and recovery for dealing with our drug addiction and homelessness crisis here in the city. And with that, I'm going to turn it to Dr. Christy Soran to walk through a little bit more of the program.
Thank you so much, Director Tsai. And just to reintroduce myself, my name is Christy Soran. I'm the Deputy Medical Director for Substance Use Services at the San Francisco Department of Public Health. Contingency management is an evidence-based treatment for people who are using stimulants and is the most effective treatment available. It's based on a principle that reinforced behaviors are more likely to reoccur. So stimulant use, particularly over time, can be detrimental to people's physical and mental health, in addition to putting them at risk of overdose. Making a positive behavior change is hard, as we all know, and it's especially hard when addiction usurps the normal reward pathways and can make it hard to work against someone trying to stop using drugs. Contingency management helps the brain associate a positive behavior with a positive outcome. So for example, if someone's participating in one of our programs, they may meet with a clinician or a peer before each visit and prepare and plan for strategies on how they're going to stop using stimulants. Then at each visit, they provide a urine drug screen. If that urine drug screen does not have stimulants in it, they get a reward, and that reward is predictable and timely at the moment that they achieve that behavior. At each visit, they continue to meet with the program and plan for their next step. How are you going to maintain this? How are you going to continue this? If they didn't achieve the behavior, they also talk about what are we going to do different next time. Usually the reward increases over time, helping this become a regular part of someone's routine. I've worked with numerous patients who have tried to stop using stimulants and have engaged in many different treatment modalities. The most effective one I've seen is contingency management, and numerous individuals have come to me and said, this is what helped me meet that goal that I've been working on. By consistently focusing on, preparing, and reinforcing that positive behavior of not using a stimulant such as methamphetamine, it trains the brain over time to associate that behavior with a positive outcome. San Francisco has a number of contingency management programs, both within our own clinics and with contracted community clinics. We have a dozen contingency management programs that are both culturally congruent and tailored to specific populations, including unhoused individuals, participants in opioid treatment programs, and men who have sex with men. Half of these programs have launched since 2023. Successful contingency management programs do three things: engage a large number of individuals, guide the participants to meet that behavior change, and successfully graduate people through those programs. Some data from some of our programs: 4 of our programs are participating in a state pilot of contingency management through Medi-Cal. It's a 24-week structured program aimed at helping people stop and cease using stimulants. So far, in the 2 years since launching, we've had 394 participants in those programs. 47% have successfully completed the program, graduated, or it's still enrolled, and 58% have achieved that behavior of stopping stimulant use at those visits. These outcomes are on par with the evidence base and national and state data. Last year alone, we had more than 500 participants involved in contingency management, and in the first quarter of this year, we've had 284 participants in all of our programs. I want to put this out to anyone who wants to stop or reduce their stimulant use, that you can call the San Francisco Department of Public Health, and we're here for you. Please call 888-246-3333 to be connected to a contingency management program. We want to be here to help you reach your goals. And I'll hand it off to Director Tsai to close us out.
Thank you, Dr. Soran. I think with that, we'll go to any questions folks have.
Any particular questions? KQ Jasmine, right?
Yeah.
Okay.
What are some of the rewards in the contingency management program?
Sure,
Yeah.
Dr. Soran.
Most typically it's a gift card, and so gift card to a local store, Walgreens, CVS. All of them have limitations on being able to be used to purchase alcohol or cigarettes. That's the most common reward.
Anything else? No? Okay, great.
All right.
All right.
Thank you
so
all.
much.
Thanks for being here. Appreciate it.